Hello, my name is Dr. Thomas Perry. I've been a cardiologist here in Phoenix for the last 30 years. Cholesterol is a biochemical that's produced in the liver and is utilized by the body to synthesize nerve tissue and hormones and cell membranes. This chemical can develop very high levels in the tissue and cause the deposition of plaques of cholesterol in the arteries. And this most notoriously leads to heart attacks and strokes. The arteries start out when you're young looking like this. If you're a smoker, you have bad exercise habits, you have a bad diet, or you luck out poorly with genetics, and especially if you're male, then you're going to start building up plaques that look like this. And this can lead to plaques that are this bad. And when they're this bad, there's not enough flow getting into the organ, and the organ starts to have dysfunction, such as in the heart. It starts to get weak, or to give you pain, or to form a clot which will totally block off all the blood supply and destroy that part of the tissue that this artery is supplying. A large number of people don't know until it's too late and they're out of here. So that's why it's good to go in for medical checks and try to find out as early as possible if you have a serious problem, and then take measures to prevent the progression of the disease. There is a technique by which we can identify who these patients are that are at high risk, and that is a CT scan of the heart, in which we look for the calcification of the arteries. And the more calcification that you have, the greater amount of plaque is present in your arteries, the greater the overall burden of the plaque on your circulation, and the higher the risk is that you're going to be disabled or killed by this disease. The calcium score is a very, very easy, painless test with minimal radiation exposure, insignificant radiation exposure, which is also very low cost, under $100, and which ends up being the strongest test to determine what your prognosis is. So we're looking to dissolve the cholesterol, shrink the plaques, and open up the arteries with medical treatment. The pharmacotherapy that's developed in the last 25 years is one of the miracles of medical science. We have statins, which are proven beyond all doubt to be highly effective and very, very low risk. We also have about 6 other different types of medical treatments that can be added on to statins to achieve very, very low cholesterol levels and reverse atherosclerosis, shrink the plaques, and prevent further problems as far as heart attacks, strokes, and sudden death.